Hello, welcome to the IHS Tribal Urban Indian ITU Health Facility Cancer Assessment Collector tool. In this second video installment, I will be highlighting how to use this tool to report new information about ITU health facilities regarding the cancer services that are provided on site. In the first video installment, I provided a tour of using this application, though as a reminder, if you are searching for an IHS facility, this button list here allows you to ensure that you are looking actively at a list of IHS facilities. Please keep in mind that we have an actively curated list of these facilities, and so if you are looking for a facility, please feel free to search it by its name, address, IHS area, or state, or scroll through if you're familiar, as these lists are in alphabetical order. For example, if I had familiarity with the absentee Shawnee Clinic and wanted to report cancer information at this facility, I could open this application here, selecting the View and Update button to open a menu here. For absentee Shawnee, I can read that at this time, only screening services have been provided at this location, not diagnostic and treatment services. If I wanted to provide additional information for this facility, I would open the Update Cancer Services Information, which would launch a survey form in a separate tab. When I am completing this survey, I will want to share that I am another contact for this facility and then proceed further. For example, if I'm looking at this particular facility, certain questions are not editable for me, such as the location name. When I'm looking here, if I needed to change information related to cancer screening, I could do so here by modifying the question, either selecting or unselecting it. This question for cancer screening opens this menu where I provide that, yes, of the on-site cancer screening, breast cancer services are provided, and then I can choose options including which specifically are included. If I were to also choose lung cancer services or colon cancer services, separate questions will appear where I can report that of the lung screening services, we use tomography on site, or that for colon cancer screening services, fecal and stool testing, sigmoidoscopy, or colonoscopy are provided. In addition to the menu setting here for screening services, there is a separate menu for diagnostic services where I can again report whether breast cancer, lung cancer, colon cancer, cervical, or oral cancer diagnostic services are provided, such as breast cancer, lung cancer, colon. Treatment services are not reported by cancer disease state. And so if I select cancer treatment services, I have the opportunity to select which services are provided based on a series of menus. Oncology-related treatment services can include radiation, surgery, hospice and palliative care, as well as traditional healer services. If I wanted to report other services not listed here, I may select this other option and provide a list item here. However, I would recommend that you first check specialty services, which might include infusion nurse, patient navigator, and an infusion pharmacy technician, or support services as well, such as partnership, survivorship, transportation, translation, and traditional healers. When you feel confident with your answers that you have reported, you can proceed to the next page where you can provide an inventory saying, yes, for the services I have reported, their equipment is working and functional, and submit the form. Submitting this form publishes all of the changes that you have made and removes any selections you have removed. In doing so, you are immediately updating the Cancer Collection Assessment app and the Patient Navigator tool. Be certain that when you're doing this Survey 123 form, that you are confident with your answers as you are automatically updating and authoring new authoritative information that will be shared publicly. Thank you for your time and support and care to the accurate recording of new information about cancer services.